I think a crisis is when you have adverse circumstances and you don't have a plan to deal with those challenges, and that's not the case. In fact, the opposite. We have been planning most of the year now for the challenges of winter. We had a very challenging winter last year as well. But are there highly challenging circumstances on the front line? Absolutely. And I think the thing I'd like to say is a very, very big thank you to all NHS staff, not just from me, but from the whole country, because I think we are incredibly proud of the efforts they're going to keep patients safe, working well beyond the call of duty.
You're saying a big thank you to NHS staff. They are saying, I'll read out the following: Richard Fawcett, Senior Doctor in Emergency Medicine, I personally apologise to the people of Stoke for the third world conditions. Dr Taj Hassan, President of the Royal College of Emergency Medicine, we are seeing conditions people have not experienced in their working lives. Dr Nick Scriven, President for the Society of Acute Medicine, the position is as bad as I've ever known. Tracy Bullock, another one, Chief Executive of Mid Cheshire Hospitals, who says, I'm 34 years in and I've never seen anything like this. So shall I ask that again? Is this a crisis?
Well, as I say, I don't dispute their experiences. It is very, very tough on the front line. But if you just look at what we're coping with this year, compared to a year ago, around 3,000 more people going every single day to our A&E departments.
You're happy to say that we plan to cancel 55,000 operations or postpone. You're happy to say that that was part of the plan?
Let me explain exactly what the plan was. So this time last year, what we ended up doing, because we had extreme pressures, is cancelling a lot of operations the day before.
But just because you're not cancelling them with 24 hours notice doesn't mean that this is a step in the right direction. This means you have a systemic crisis. You have a massive chronic gap between your needs and your resources. You recognise that, don't you?
Well, I think it's really, there is a resources issue which we can talk about, but it's really important to recognise that this time of year creates pressures in health systems all over the world. So they had a terrible winter in Australia, which was our summer.
But it's not just about this time of year, is it, Secretary? Let me tell you, 3 years ago, as you well know, in October of 2014, 200,000 people were in that group category waiting more than 18 weeks for treatment. You will know well that by the end of last year, that number had doubled, 400,000 people. So this is not something that just happens over Christmas or over winter. This is the direction the NHS is heading in.
Well, let's look at the longer term performance, because in the 5 years that I've been Health Secretary, we have an NHS that is doing 5,000 more operations every single day. The accident and emergency departments in our country are seeing 2,000 more people every single day within the 4-hour target. We have more doctors, more nurses, and an independent report published in the middle of last year said that in most major disease categories, outcomes have dramatically improved. So
you were hitting your A&E targets in July of 2015, 95% of patients dealt with within 4 hours. You haven't met that target since 2015. Is that wrong?
No, that is correct. But that is not the entire measure of the performance of a healthcare system. At the
Does
same
the target not matter? Tell me if these targets are out of date and we can get rid of them.
Of course it matters, but in that period, there are 7,000 people alive today who wouldn't be alive if we'd had the cancer survival rates of 2012. So you have to
set these targets and you're missing them. If that was the last time you reached the target, which was July 2015, where are we now with that?
Well, I'll tell you exactly where we are. We are treating more people than we ever have in our history within the 4-hour target.
But with the 95%, because you used to publish this data on a weekly basis and now we don't see it, you will know that figure. What is that figure now as a percentage?
No, we publish it on a monthly basis, but let's just look at the last published data. Next week we'll have the data for the whole of December. But if you look at the November data, let's just look at specifically the issue you raise of A&E. The data from November shows that every day, in fact, the number of people we're treating compared to 7 years earlier is 5,000 more within the 4-hour target. It also shows that more than half the hospitals in the NHS are performing better on A&E than a year previously. It also shows that
those numbers don't match. I'm just asking for the percentage so that we can let the public understand how they compare. Why won't you tell me what the number is as a percentage? It's not my target, it's your own target.
Because we don't have a number to publish. There's no number that I'm sitting on that I'm not telling you. As you know, what happens is that the data is collected across the system once a month. And that data is then validated and it'll be published next week, and I don't know what that number will be, just as you don't know what that number will be.
So are you happy to tell these people, whether it's Richard Fawcett, Taj Hassan, Nick Scriven, Tracy Bullock, chief execs, experts in their field, that everything is going according to plan? That you are reaching targets, that there is not a crisis, that there is no systemic problem with the way the NHS is funded or is working right now? Can you tell that to frontline staff?
You're putting words into my mouth, and I haven't said that.
I'm asking you that question.
Exactly. Well, you're putting words into my mouth. What I'm telling you is there is extreme pressure on the front line, and we are incredibly grateful for the hard work that those doctors and nurses and many other people are doing.
And you're asking for that money from the Prime Minister, from the Chancellor, are you?
I'm asking for money, and I've been given money, and that's why in the last budget I got an extra £2.8 billion. We are going to need more money going forward, of course, but let me say this. It isn't just about money, it's also about manpower.
You won't have the manpower if people think that they're in a crisis and they're not able to work in the conditions that they're being given.
Well, I'll tell you how we get the manpower, Emily. We get the manpower by training more doctors and nurses. It is going to take time for those. It takes 7 years to train a doctor, 3 years to train a nurse.
You've got somebody who said they've been working in this for 34 years. What do you say? Bye-bye to them because they say it's the worst crisis they've ever seen?
I say to them, thank you for the amazing work you're doing. Please bear with us. We are trying as hard as we can to train up more doctors and nurses to get into the system.
And if voters in England or patients who've had their operations put back or frontline staff who have expressed their frustrations need to find somebody accountable for what they are facing right now, who is that person? Is it you or is it Simon Stevens of NHS England?
Well, ultimately, I am accountable for the treatment of every patient in the NHS. I'm the Health Secretary. And to people who've had their operations delayed because of the winter pressures that we're now facing, I apologise, because I recognise that it is a very, very big deal if you need a hip replaced and you're having to wait longer.
Jeremy Hunt, thank you.